Hello, everyone. Welcome to our webinar this evening. We are calling it E-Curbsides to Tumor Boards. We will be discussing real case examples and real benefits of collaborating via online medical communities. My name is Eric Glazer. I am the Vice President of Physician Engagement and Social Media at Best Doctors. I will also be your Master of Ceremonies for the next 55 minutes or so. WebEx limits us to 4 camera shots, so I'll be the guy behind the scenes who you won't be able to see. Our panelists, hopefully you'll have a clear vision of them via your video panel up there. Some housekeeping items before we begin. Those in attendance are eligible for 0.75 CME. We need to change the slide. Yep, thanks. And we are not kidding around when we have an official disclosure slide. So we'll keep this up here for the required time. And as we do this, I want to remind all of you that if you are brave enough to venture into the world of Twitter, we'll be using the hashtag MEDSM, short for medical social media, for our tweets and questions this evening. Our Crackerjack content and webinar team is working behind the scenes, and we'll be watching for your tweets and questions. For those of you who are still old school, you can ask questions to me and the panel via the Q&A module in the bottom right-hand corner of your screen. In addition, we will be returning the favor. We'll be asking all of you some questions from time to time. We call these our audience polling questions, and they appear on the right-hand side of your screen as well under the polling tab. We always like to ask an initial icebreaker. So on topic tonight, and this won't be too difficult to answer, we're going to ask all of you, how do you usually collaborate with your peers? Is it face-to-face, via telephone, email, or an online portal or medical community? So you see the polling tab in the bottom. I think it's your last tab on the bottom right-hand margin. And you'll see the question up there for a couple of minutes, and you could just click and choose. We'll probably ask you a couple of more as the evening progresses here. Our learning objectives for today: we're aiming for you to come away from today's discussion with some anecdotes on how you could improve participation in your tumor boards by creating a virtual asynchronous environment where doctors can collaborate. We also want to guide you in how online medical communities can facilitate easier and safer curbside consultations. And finally, we want to identify for you best practices in choosing and using medical communities for case consultations or tumor boards. Actually, Kelly Cleary, who's our content manager here at Best Doctors, just completed a mini white paper on best practices, and you can request a free copy of that at the end of today's session. We will be actually doing the Q&A portion of today's session, last 10 or 15 minutes or so. We'll put up on the screen a survey, for an interactive survey for you to take. It takes about 2 minutes to complete, and this survey will allow you to request CME. It'll allow you to request a copy of Kelly's white paper, and it'll also allow us to receive feedback from all of you on how we did this evening and what topics we should be covering in the future. I know most of you are familiar with Best Doctors. If you're new to us, just in brief, we as an organization, we contract with large self-insured employers like Home Depot and Pepsi, and sometimes health insurance carriers like Aetna and Blue Cross Blue Shield, and we provide medical advice and consultations. Typically, it's the patient who calls us with a simple question or maybe a complex medical condition. Sometimes it's the patient's treating physician, and we'll either match that case with an expert and quickly answer that question, and sometimes the case requires lots of data collection, and we have an entire medical records team that collects all the medical records. We sometimes rerun the pathology. We'll have an internal medical team summarize the case. We'll case match it and have one of our experts around the country write a detailed report. But we also provide a product called MedTing, which is an online tool that simplifies collaboration for physicians. It's one of the reasons we're covering the topic that we are tonight. It's a cloud-based enterprise solution. It's often purchased by medical societies and ACOs, foundations, and hospital systems. And it's meant to connect doctors and fosters easy file sharing, image viewing, and collaboration. We're currently deployed in 37 organizations around the world, stretched over 6 continents. So we're not just in Europe and the U.S., but we also are in Africa, Asia, Australia, and South America. So I promise today will not be a commercial. In fact, if we finish a little bit early, 10 of 9 maybe, I will maybe do an online demo of MedTink for those of you who want to stick around. But we're going to focus the remainder of the time on discussion amongst our expert panelists. And with that, I want to formally introduce all of them to you. As they speak, they should have their, if WebEx is working correctly, you should be able to see them up in the video screen above. In alphabetical order, our first panelist is Dr. Gary Choi. He's a radiologist in the Division of Emergency Radiology and Teleradiology at Massachusetts General Hospital. He's also the founder of RadRounds, which is probably, if not the biggest, one of the biggest physician online communities. It connects radiologists for networking, collaboration, and education. So, Gary, thanks for joining us. Our next panelist is, actually, Gary, could you give me a hello just to make sure that we've got you on audio here?
I'm right here. Thanks so much for the introduction.
Perfect, thanks. Dr. Matthew Katz is our next panelist. He is on staff at Radiation Oncology Associates and serves as the medical director of radiation oncology at Saints Medical Center in Lowell, Massachusetts. He is the creator of a web-based tool for prostate cancer called CAP Calculator, which helps promote shared decision-making between patients and prostate cancer specialists. Matt, thanks for joining us and welcome.
My pleasure. Thanks for having me.
Our next panelist is in a little bit warmer climate, but not much warmer lately. It's Dr. Ryan Matanik. He is the assistant professor of medicine at UNC School of Medicine in Chapel Hill, North Carolina. He also works in the Center for Esophageal Diseases and Swallowing and is currently the director of the UNC Gastroenterology and Hepatology Fellowship Program down there. Ryan, thanks for joining us.
Thanks so much for having me.
And last but certainly not least is Dr. Miguel Perales. He is the Deputy Chief of Adult Bone Marrow Transplant Services and the Director of the Adult Bone Marrow Transplantation Fellowship Program at Memorial Sloan Kettering Cancer Center down in New York City. Miguel, welcome.
Thanks. Happy to be here too.
All right, gentlemen. So we were going to get started here. Sort of what we did with the audience with an icebreaker polling question, we're going to do the same for all of you. And we're going to just talk about social media and online medical communities and how you have seen the emergence of digital technology impact the way you and your peers are collaborating. So I'm going to start with Gary, and we'll go around the virtual room here. Gary, how is it changing the way?
Yeah, I would say that in the last few years we've seen a lot more tools available for physicians to communicate, to be hyper-connected now. In the consumer world, we have Facebook, Twitter, and we're starting to see that there are also very specific tools for physicians and healthcare providers to communicate. And Eric, you mentioned MedTink, for example. That's one excellent example. There are others as well. There are websites like Sermo, Doximity, and several others. There's one
hey, Gary, excuse me. Gary, I'm going to ask you, could you back away from your mic a little bit and maybe speak up? You're coming in just a little bit muffled, and I'm guessing I'm hearing.
Can you hear me now?
Yeah, that's better. That's better. So if you back up and yeah, perfect. Go ahead. Sorry to interrupt.
Yeah, no problem. Sorry about that. I'm on a headset, so hopefully this sounds better. So basically what I was starting to mention was we're fortunate to have a lot of new tools, especially for physicians and healthcare providers. And Eric, you started to mention MedTink. There are others like Doximity, Sermo, and many tools that are really available for collaborating and meeting new experts, people in your field. And one of the things I found really refreshing is that you can really use online platforms to discuss any topic with anyone. So, for example, you can share radiology cases on radiologists. And so being able to share an interesting case or to see an interesting case through social media, through online platforms, of course, while keeping with privacy concerns, keeping everything anonymized and abiding by any policies that your institution has, using online platforms is really a great way to communicate with other healthcare providers. An example is using this in outreach. For example, I do a lot of teleradiology outreach where I look at cases, teach residents from Africa, Haiti. It's a really great way and low-cost way of collaborating. Another use case, besides teaching or outreach, is you can store online teaching files. So radiologists like to collect interesting images. So you could actually use something like MedTin or other platforms to really store your teaching materials for future use or for future presentations. Online platforms also allow for connectivity to other sources of data like news, latest research, for example, PubMed, CME. So online platforms really are changing the way physicians can use their time to consume the appropriate information, also deliver, whether it's education. And I'll to this maybe later, and how online platforms can start to deliver clinical care.
Interesting. It's great. Matt, do you see it changing the culture up in Lowell and where you've been working?
I think so far, at least among my peers, I haven't seen a lot of use of social media. The exception so far for what I've seen is Doximity in terms of people connecting. Personally, I haven't used it that much, but I've gotten a fair amount of requests to be involved and to connect with people. So most of the time when I'm interacting with people professionally for other healthcare professionals, it's either Doximity or LinkedIn. That said, for interacting with people for communications in healthcare, most of my communications are with people I have not met in person, but that I've interacted with online, mostly through Twitter, but to a lesser extent on Google Plus or Facebook.
And Ryan, what about you? Do you see it, certainly like at a university, do you see the impact of digital communication amongst your peers changing the way doctors are communicating versus when you were in residency?
Oh, absolutely. There's been a great increase. Actually, Matt mentioned LinkedIn. I think in the last year there was a great increase in the number of physicians, both private and academic, who started to join LinkedIn. Now they don't always know how to use it or use it optimally, but they're at least joining the realm of business. The other things that are happening that I don't think anyone's mentioned yet, I think Gary may have mentioned a little bit about telemedicine with radiology, but this is really transforming care to areas that don't have a lot of access. The University of New Mexico has a big center, and they actually published a study in the New England Journal last year or 2 years ago where they used telemedicine to collaborate with physicians in a rural setting to provide care for patients with hepatitis C, which is really phenomenal. And now this is starting to really take hold in a lot of different communities. Another thing that's happening, there's things like teledermatology, where you could take a picture with your cell phone and take a picture of a patient's rash or a patient's lesion and try to figure out what it is by sending it to another dermatologist. Now, I'm not in the field, so I don't exactly know how that works, but this is another option. And even PubMed, even the government is experimenting with its own form of social media on PubMed. I think it's called PubMed Commons, where you can, if it's in beta testing still, but you can comment directly on the abstract just by going through PubMed. And this is really going to change. This is going to change the way we think about research, about data that comes out. You're going to be able to communicate with the authors, potentially with the authors of the trials or other people, and express concerns about the research that would never get published in a journal otherwise. So I think there's a lot of new things that people are experimenting with.
That's fascinating. Well, what's the timeline for that? Do you have any idea? Have you seen that in action? Are you getting involved in posting comments on
I have seen it in action. I see it. PubMed Commons. I think it's still in beta testing. Let me see. Looking it up right now. It's piloting. Yeah. So I've seen it. It's not taken off yet, but that's because it's in pilot testing, and they must be doing some stuff behind the scenes. When I think when it goes live formally, you have to right now apply for an account. I've posted on a few abstracts, not that many, but so far I've posted. It's interesting. I think it's really going to change the landscape of academia to allow everybody to have a say and in what the data means, and then really it's the biggest form of peer review you can have. We're going to do a session once this goes live with the medical librarians, because this is a great opportunity for the MedEd chat group, the medical education group, and the medical librarians group to just really collaborate. So now we're not just collaborating with physicians, we're talking about interprofessional collaboration. So this is just a great opportunity.
Oh, I totally agree. Keep me in the loop on that. I'm sure our audience today is probably equally interested, and we could. Yeah,
I can send you the link. I'll send you the link on it. I'll post it on FedSim.
We'll keep our audience posted on that. We'll send them whatever information you could provide us in any follow up. We'll actually add that if you guys request the slides or Kelly's white paper. We'll include any information we get from Ryan as well as follow up. So Miguel, I'm interested in hearing your answer, because you're at a specialty hospital, also a teaching facility, but a specific specialty hospital. How has social media and online community changed the communication culture down at Sloan?
Sure. Actually, I first wanted to touch on the PubMed issue, and the PLOS One journal and the family of PLOS journals all have that. Hey,
Miguel, I'm sorry. I'm going to do the same thing. If you could back up a bit and then speak up. You're coming in a little bit muffled.
Okay. Is this better?
It's a little bit better.
Okay. So the PLOS One journal also has the same option for comments. And actually, we recently published an article in the journal, and I haven't seen any comments yet on our paper, but they do offer metrics so you can see how many times it's been viewed, how many times it's been downloaded. And there's also the option for discussions of the manuscript. So I think we're going to see more and more of this sort of interactive, discussion of research, even after it's published, beyond the sort of traditional letter to the editor, much more lively back and forth with the investigators and other investigators. So I think that's something that we're going to see more and more in the future. Going back to the original question, which is the use of or how social media is impacting our daily activities at Memorial Sloan Kettering. I think of it as two different spheres right now. There's sort of the scientific collaboration, research collaborations. We're seeing much more engagement either through LinkedIn, through Twitter and other platforms. And then there's the clinical care component, where I think we're sort of very much still in the traditional mode, where we have local tumor boards, where we discuss cases, and then where we reach out to experts at other centers. But it's very much sort of, people people you've connected with at some point. And we have sort of this shadow network of colleagues across the world that will reach out to us or reach out to us. But it hasn't really been formalized into a community or into a network. And so it's very much one-on-one discussions that don't really benefit, the rest of the group, if you will. And, we can certainly talk more about the efforts of ASBMT to sort of overcome that.
So Miguel, did you mention expats? I'm sorry, you're not coming completely and clearly, but I wanted to follow. Did you mention communicating with expats? Is that something that you said?
Yeah, so we have, I get emails from physicians across the world, asking me about cases, and I'll email experts at different centers if I have a question, and they have the expertise that we don't have. I think there's a lot of communication between physicians, but it's sort of an informal network, and some people may be intimidated reaching out to, Dr. So-and-so at Dana-Farber, for example, to ask a question. And so I think it's a very informal network of experts. And there's definitely an access issue in terms of people being able to connect with people.
It's great. Now, let's talk a little bit. Let's talk a little bit about Twitter, and I'm going to start with Matt. I know Matt and Ryan are really big into Twitter, and I'd love to hear how you're using it and what it's best for, and maybe what are some of the drawbacks. I'm sure there's a lot of doctors right now on the phone right now, probably skeptical of Twitter. I'm not sure, but I'm guessing at least half of our audience probably hasn't even signed up for it. So I'd love to hear what you guys like about it, how you're using it, where you think it's benefiting you as a physician. Matt?
Sure. I'd say, my background is a little bit different in terms of how I got involved in social media. My interests have been less connecting with other physicians and healthcare professionals initially than learning how to interact with patients and understand what some of their concerns are outside of my clinic so that I have a better way to help them when I actually see them. And so I started off trying to learn through actually the website Dig, which is a defunct social network at this point, but a lot of it was real-time interactions and writing in forums. That brought me eventually into Twitter, and it was a little bit more confined, using 140 characters, but I found that the real-time interaction, getting to interact with a variety of people, whether it was people in my field or more likely people that were struggling with cancer, I found it just very rewarding and an easy way to learn. So I initially started getting involved in just listening first, and eventually came upon some of the tweet chats that have been very active, HCSM, and then some that are disease-specific or specialty-specific as well. And
could you, for our audience, could you define what HCSM stands for?
So health, I think it's officially standing for Health Communications and Social Media, which was developed by Dana Lewis several years ago now. It's been about 2.5 years that I've been involved in a breast cancer specific group, BCSM, which has been very robust, very active, and has been a great way to interact with advocates, patients, a variety of healthcare professionals, both surgeons, oncologists, psychologists, and it's been just very rewarding.
Great.
Anything else you'd like me to touch on specific to that? I could go on, but I don't want to take up too much time on Twitter. If we need
I am going to give you some credit, some trademark credit that you've been very humble about. But the hashtag we're using tonight, MEDSM, I remember. Correct me if I'm wrong. I remember this maybe from a year and a half ago. This was your brainchild, correct?
No, actually, I can't take credit for that.
That was me.
Take credit for it.
That was me. That was me. Sorry, Eric. Sorry, Matt. Yeah, I wrote a blog about that a couple years ago. So, yep.
Yeah. Oh, sorry. I thought I was talking to Ryan. That's what I thought.
Yeah.
Okay. Yeah, no, I've done something separate for disease-specific areas rather than interest areas, which has been for cancer care, having disease-specific hashtags that the American Society of Clinical Oncology, MD Anderson, and others have started adopting, but it's still in an early phase, and that's on Simpler in terms of where the list is. But the idea is just finding ways for people with similar interests to connect, and hashtags definitely help with that.
Terrific. Sorry about that, guys. I'm trying to tweet and listen at the same time, so I'm not looking at the video, and I thought I was listening to Ryan. So, Ryan, I'd love you to expand upon that as well. That'd be great.
Yeah.
How do you see Twitter?
So, like Matt's experience, I didn't go into social media with an intent to go into social media. I went there, actually, my intent was something different, or onto Twitter specifically was something different. I wanted to start a blog for my patients and for patients who might come to see me or who might never be able to see me because they're not in the area or what have you. That would be specific to gastroenterology or esophageal disease, my specialty. And when I went to get more engagement, I went onto Twitter, and that's when I realized what was there. And Matt sort of alluded to this, it didn't just allow me to collaborate with physicians. I learned so much about the patient side of things, and I realized just how things had changed from the physician being a respected member of the community to how many patients just don't like doctors at all because of things that have happened to them. And it's this collaboration that I think we can really harness. I'm really thrilled with something that people like Dave DeBroncard, ePatient Dave, have really pushed, and that's the ePatient movement. This is something that we've actually gone away from as we've become more specialized, and I think social media is bringing us back to it. I give the analogy when I give talks about this of how when you're in the old days of medicine, you were a community physician. If you were living in the community, everybody knew you. You knew everybody. They knew everything about you. You knew everything about them. They knew everything about your family. You knew everything about their family. All of a sudden, we've started to become sheltered and value our privacy and want to hide ourselves from everybody. And in doing so, we've separated ourselves from the community that we want to help. And patients feel that. They feel a disconnect between their doctors and themselves. And this movement like the Society for Participatory Medicine and the ePatient Network is a great way to get back into what we're really trying to do, which is help the patients to have a better quality of life, better health, ultimately maybe live longer if they have serious illness, with good collaboration with their physicians, not as being told what to do, but being as valued members of the partnership. So that's what I've really noticed. The other thing, there's thing I've noticed on Twitter specifically is that I've had people ask me from abroad, from across the country, ask me questions, not necessarily about a specific patient, but about a question that they had. You know, I remember a year or two ago, I keep this in my slide deck. Bobby Gahary is one of the big docs on the Twitter sphere, asked me a question about one of my subspecialty interests that crosses our fields. He's in ENT and I'm in the esophagus, so we have a lot of things that touch one another. But other docs can ask each other questions and get that response relatively quickly. It doesn't just happen in Twitter; it can happen anywhere. But social media has really changed that.
It's great. A couple of questions are coming in. Just as a quick little reminder to everyone, the Q&A module should be towards the bottom right-hand portion of your screen. You can click on it, open up that window, type in a question, press submit. It'll come into the queue. Our team will field it. We'll make sure we get them sprinkled into the discussion here this evening, and towards the end, we'll hopefully have a few minutes for Q&A as well. There was a follow-up question for you, Matt, around you had mentioned that you were on a tweet chat specifically for breast cancer. Are there any other tweet ups in other disciplines, and is there any multidisciplinary tweet ups that are occurring on Twitter that you know about?
Sure. So I would say in terms of diseases, if you go to Simpler, they have a whole set of hashtags. So if you look up Simpler's health hashtag project, there's a whole slew of them that are disease-specific as well as different kinds of ones that are multidisciplinary around a certain topic. The ones that I tend to participate in that are disease-specific around what I do, which is cancer care, are BCSM for breast cancer. There's one for lung cancer, LCSM. There's also another one that has been started recently, GYN-CSM. One that's been around for a while for brain tumor survivors has been going BTSM. And then it's also something I haven't done as much, maybe Miguel knows about this, is MMSM, which Mike Thompson helped get going for multiple myeloma patients. So there are a variety of these. They occur pretty regularly. Some are weekly. Some are monthly or every other week. And it's a great opportunity to really get a sense for what's going on in different areas. And for me, as a general radiation oncologist, I take care of all sorts of adult cancer care patients. So I sort of cover a lot of areas, and hearing what's going on with my patients and what kinds of things they're getting in the news is very important for me, because I may find that those are conversations I'll have in my office. So I personally find that very helpful, and there is a lot of multidisciplinary involvement, some more than others. There are, separately in certain disciplines, really great opportunities to learn more from each other. A good example that I recently came across is one EuroJC, which is for urologists, having a monthly journal club. Basically, they select an article, they plan on doing this globally, and they actually share a specific article, and people will comment from around the world. And so it's not all real time like some of the tweet chats where it's compressed into 1 hour, which sometimes gets a bit frenetic and it's hard to keep up with everybody. But you can actually learn a tremendous amount, and it's been a great chance for me to interact with urologists to discuss prostate cancer care, most recently in this chat, but next month it could be about something completely different. So I get to learn a lot from colleagues, both who may be in the same area of interest but may have a completely different perspective from mine, that helps me when I get back to dealing with patients in real life.
And actually,
Go ahead.
You know, one of the things that, and Matt was mentioning, mostly cancer things, but the cancer chats, but some of the other communities have started. ID has just started an ID chat, hashtag ID chat. Ortho, I'm not sure if they're still going on, but I know Ortho's involved. The key here is when there is a group that's big enough on Twitter, that's when it sort of starts to go. The hashtag usually comes first in many situations, but in these Ortho chat and ID chat, the hashtag was developed. People are experimenting with different things all over the place. There was a hashtag TwitJC, I'm not sure if it's still being used, but where they used to do a weekly or monthly Twitter journal club, which was a non-specific, it was a general journal club for anybody. So lots of opportunities on Twitter. The good thing is you don't have to be in any specific community. No one is excluded from these chats. You don't have to join. The only thing you have to join is Twitter, and anybody can do it. Even a person who is not a physician, if they have interest in the abstract, in the topic, they can chat. That's what's neat about it.
Right.
I would say one other nice thing about it is you don't actually have to participate and tweet to still appreciate it. If you put into the search function the hashtag that you want to follow, because then you can just quote unquote lurk, which means you can actually learn something and you don't have to participate. I do think, as a caveat, one of the drawbacks is for people that aren't ready to share health information, you do need to keep in mind that Twitter is an open social network, and so there are issues with privacy for people who share. And one of the things I do feel that is important for particularly patients participating to know about is it gets easy in these conversations sometimes to share maybe more than you otherwise would, and just to be careful how much of your health information you do share online if it's about your own health as opposed to a health topic.
So that's actually a great transition. So I'm going to ask two questions in one. First, to the audience, we're going to put up our next audience poll question around online communities. Oh, sorry, my screen just moved. So why would online communities be of value to all of you? And you're going to see that in the bottom right-hand side of the screen. Now, Matt just mentioned a drawback, or not necessarily a drawback, that Twitter is a public forum. So Gary, you founded Rad Rounds, which addresses some of the drawbacks of the public forum because it's more of a gated online community for physicians. So what are some of the advantages of a gated online community versus something like an open forum like Twitter?
Right. Twitter definitely is really interesting, and I would say that it's the example of the opposite of a closed community. Twitter, you can reach anyone. And I must admit, I am becoming a Twitter addict, and I've met a lot of people on Twitter and really see the huge benefit opportunities in an open network like Twitter. As far as to answer your question about a closed community, I founded Rad Rounds in keeping with some of the things that we do day-to-day as physicians anyway. We have rounds both multidisciplinary and also within our own discipline. So radiologists, for example, have case review sessions. We call them radiology now. We have them with other physicians as well, but we also do our own radiology now. And so when I started Rad Rounds, this was a virtual version of that, where you can get together with other radiologists, share cases, puzzling cases, interesting cases, and really just have a very focused discussion among peers. And so that's how Rad Rounds got started, really as an initial discussion board, a message board around cases. And so one of the greatest advantages is that everyone on Rad Rounds is somehow affiliated with radiology, and so that when you look at the member directory, people who are in there are either radiologists, radiology technologists, somebody in business, and so we've been able to really communicate on the same language, first of all, and secondly, the time it takes to find what you're looking for, let's say in radiology, an interesting case, it's much more efficient way of communicating with somebody in your field. It's high yield. It saves a lot of time. If you're in a gated community, you already know the people, you get to know them, just like you would in your own practice or on your regular radiology lab. The same people show up, and you invite more and more people. It's also a regular venue you know that you can trust. Everyone in there you feel comfortable with. And so this is so online communities offer, gated online communities offer this sort of real feel of how you would have a community within medical practice, but it's just online. So I would say that's one of the advantages a gated online community offers, both trust, familiarity, the opportunity to meet like-minded people, and it really is high yield.
Thanks, Gary. That was great. And incidentally, folks, we about a year ago with Gary and Matt and a few others co-authored a Twitter 101 for physicians. I know there's some 101 questions coming into the Q&A module. We'll offer that up too. So we put that survey up towards the end of today's session. You could request that Twitter 101 paper as well. We'll make sure we get that to you if you're interested in reviewing it and reading it. So Miguel, you've been experiencing, social media recently. You've been experiencing a little bit of shift. How is that impacting specifically the tumor boards, and how do you think tumor boards can be impacted by digital and social?
Sure. So I think there can be an impact at several levels. I think we'll continue to have sort of the traditional or center-based tumor boards. But I think more and more we're going to see an integration with social media. So, for example, if you look at our own center, we have a pretty big transplant service. And so I think we'll continue to have, the traditional discussions of transplant cases among ourselves. But there are cases where we will reach out to an expert, a colleague, at some other center. And you can imagine that if you had a virtual community, such as the one that ASBMT has developed with MedSing, that either before you discuss the case locally or after the discussion, that you would use the virtual community to also discuss the case and sort of, reach out to other experts. The other setting which I can see, a virtual community being very useful is the fact that at Memorial we do have satellites out in Long Island and New Jersey and Westchester, and in those situations we do have already in place some sort of virtual tumor board. And part of it is also a scheduling issue and getting everybody around the camera at the same time. And certainly in a virtual setting, I think it would be much easier for us to discuss cases and have input from experts, both in the community center as well as at main campus. And I think, I really want to touch on the issue of the gated community. But I think as we're discussing cases, certainly you don't want to put out all this medical information out on Twitter or other platforms. And the really fruitful discussions are going to come from cases where you can really share all the medical details. And it becomes really cumbersome if you have to sort of de-identify and change the gender and change the age and so forth to be able to put the information out there. So the more information that you're able to share with the other physicians in the community, knowing that it's a closed and gated community, I think leads to a more pertinent discussion to the case at hand. and therefore is much more relevant to actual patient management as opposed to being some sort of academic exercise. I think the other advantage is that, or the other things that we can also do with these gated communities, we can also use them as educational tools. I mean, I'm very excited with the one that for ASBMT to be able to use it as an educational component for trainees, either fellows in training or even junior faculty, and to create a library of interesting cases that they can then review and see the discussions that took place and learn from that.
Thanks, Miguel. It's great. And as far as I could go in a couple of different directions here. Let me address one question real quick from the audience around just getting started in the social media, because a lot of really good points were made in different venues. And I want, Miguel, to start with you. What would you advise one of your colleagues for first venturing into social media? What would be the first steps that you would recommend them taking?
I mean, I think there's a lot of tools out there. There's links to Twitter 101 and sort of how to get familiarized with that, and sort of you learn to follow some experts, and then you learn from them, and eventually you join the conversation. I think in terms of the gated communities, where really you can have much higher level discussions, I think the ASBMT is about to launch one next month, and we're going to encourage membership both within the ASBMT community, but also within the transplant community at large, to really participate in this and both learn from it and contribute to it. And I think we really want to, show that this can offer a learning tool, but also an important part of delivering medical care for our patients.
Great. Ryan, I actually want your thoughts on this as well. Before you jump in, though, I'm going to put up another poll. If there's folks interested in seeing MedTing, Miguel just alluded to it earlier regarding tumor boards and the ASBMT. If folks want to see a live demo of MedTing, I'll stick around from like maybe 8:55 to 9:05 and give a quick live demo. We're going to put up a poll and see if you're interested. If folks are getting tired and it's getting late, that's fine too. But we just wanted to put up a little temperature, get your temperature on this, and we'll stick around for a few minutes if you're interested. So back to the question about getting physicians started on social media. Ryan, I wanted to hear some of your pieces of advice for your fellow colleagues out there who are thinking about getting started. You mentioned what inspired you, and maybe it'd be interesting to hear how you actually got started.
Yeah, so, and it's funny you mentioned the Twitter 101. I actually wrote a 2-part blog about a year and a half ago. I'll post it on the stream, called "Okay, I'm on Twitter, Now What? A Primer for Physicians," aka Twitter 101 for docs. And then second post, which was some Twitter lingo. I'll put the links on in a moment. My absolute, I'd say my very first recommendation is start
I'm sorry, Ryan.
small.
I want to clarify that for folks who are new to this. That means if you go onto Twitter and you do a search on MEDSM, which is the stream that we're using right now, and if you're following along, you'll see that most of all the comments on MEDSM are all around this webinar, and the speakers who are making points today, that's where the link will be. I just want to make sure folks who are listening at home that they know what you're talking about. Go ahead.
Yeah. So start small. The thing that can definitely happen to you is you can start to feel overwhelmed very quickly. You start to feel like you have to get into everything. Pick one. If you're really adventurous, pick two. Choose Twitter or Doximity or Facebook or LinkedIn. Don't try to read everything, because there is so much information that's coming right now. People call it the fire hydrant, and you're basically trying to take a very small sip from the fire hydrant. And start small. Start with one platform, maybe two at the most. So choose one and see if you like it. If it works for you, great. Then venture into the next one. But don't go out there thinking you're going to you have to do everything all at once. When that happens, you're going to get completely overwhelmed. That's my first recommendation for anyone who's starting the venture into social media.
That's great. And I'm going to have to say, I'm going to chime in here, although not a physician, with two statements. One is I probably learned more in my first year and a half about business and about marketing on Twitter than I did in business school. And I mean that sincerely, from all the different folks who I met and all the different guidance I got from the people I met. So as a physician, if you're thinking of a cocktail reception that sort of never ends, that's how you should be thinking about Twitter. And I've met a lot of physicians over the years through Twitter, like some of the panelists today. And in fact, the MedTing platform that I'm going to demo at the end, we actually acquired that company because of a physician I met on Twitter in Eastern Europe who knew about this company. And when we finally met the company and we saw what a match they were for our business, we acquired them. So it's an incredibly valuable networking tool. And when I mean networking, not networking for the sake of meeting new people, but networking around idea sharing, gaining intelligence, getting insights, gaining knowledge. So I want to go around the table here and get some best practices down. We promised everyone we would leave here with some best practice guidelines for getting started and how to use online platforms and communities. So I want to get that done as we near the close of today's session. I'm also going to put up in a moment the survey. It takes 2 minutes to complete. It'll allow us to get some feedback from all of you, but it'll also allow all of you to request forms for your CME credit. It'll allow us our 0.75 of a credit. It'll also allow you to request some of the information that we've been talking about, like the white paper from Kelly and the Twitter 101 from a year ago, and we'll make sure we get information that was mentioned today as well, some of the hashtags and insights. We'll try to include all of that. So I'm going to put that survey up in a moment. So let's go around the room and talk about best practice guidelines for getting started. I'm going to start with Matt, then we'll go with Miguel, Gary, and we'll end with Ryan. Go ahead, Matt.
Sorry, am I on now?
You are on now.
Okay.
It was bound to happen.
So what I wanted to say is I think just to echo what Ryan had said, you need to decide where to start based on what your priorities are. And one thing to do even before you get online, if you're not sure about it, is if you read a book called Groundswell by Charlene Lee from Forrester Research, one of the key things they outline is how to look at sort of approaching things strategically. I would suggest think about the kind of people you want to interact with and what your objectives are before you pick your platform, because a lot of what you want to do will be determined by what you're trying to get out of that particular platform. So the conversational aspects of Twitter are great, but it may or may not be the right fit for what you're looking for. My main suggestion is really to start slowly and just keep in mind that while all these tools are great, it's really no different than if you're interacting in person, and I've learned this from meeting people that I've interacted with on Twitter, including Ryan. You get a real feel for who the person is, but this is something that does affect your reputation. That's not necessarily a bad thing, but just keep in mind the way I look at things when I've posted on Twitter or anywhere else is I'm assuming my wife is going to see it, my business partners and colleagues are going to see it, my patients are going to see it. And I would treat this no differently than if I were going to have a conversation in person. Anything that I do, whether it's private or professional, I essentially consider professional if it's digital. If you don't want it to be considered professional, whether it's Facebook on your own personal page, I would just leave it offline.
Great insights, Matt. Thank you. Miguel, any tips?
Yeah, I think those are very good points that Matt brought up in terms of online reputation. I think the other point that Bob Miller made at a recent Grand Round that he gave to us is, if you don't create your own reputation online, everybody else is going to create it for you. So I think the attitude of the physician who's sort of hiding his head in the sand and thinking that this is just going to go away, that's not happening. I mean, the patients are online, they're tweeting about us, blogging about us. So I think if you want to try and have some control over the message about what we stand for and our reputation, you have to participate. And so I think it's important for us to embrace this and develop a social media personality that sort of establishes our reputation. But I do think it's critical to recognize the fact that once it's out there, it's out there. So we do have to be careful about mixing personal and professional issues. And like Matt said, if it's online, you should consider it as something that anybody can see, and therefore, it should be in line with the professional image you want to create.
Yeah, I'm going to actually provide some holistic advice to that end. I would think about the social media platforms and have a nice divider on them. I use Twitter for business networking. I still have to be very conscious of what I do, but alternatively, I keep Facebook very tight to friends and family and try to stay out of trouble that way. So you need to, even as physicians, even more so, you need to kind of pick what your presence is going to be in each platform. So, Gary, you're up.
Yeah, I totally agree. Great points, Eric, Matt, and also Gail. Totally, in terms of best practices, I would say that we really have to treat social media and any digital medium as the most powerful tool to publicize something that you're going to say. It's like a digital loudspeaker podium to the world. So everything I try to do, I would run that filter through. Would I want this to be on the front page of the New York Times? Whether it's protecting a patient's privacy, protecting HIPAA sensitive material, or even something I would want my colleagues, my family to see. At the same time, it's a powerful tool. As Miguel pointed out, it's something that we shouldn't hide from. And physicians tend to be risk averse and weigh the evidence before we act. And I think it's only true for social media. Exercise caution, but at the same time, it's a very powerful tool to engage your colleagues and to engage patients. As Ryan brought up, this is the only era and the first time in history where we could speak to so many patients at the same time, speak to so many colleagues at the same time.
Thanks, Gary. Now, Ryan, you're going to be you have the biggest challenge now because all the easier answers are covered now. All the easier best practice guidelines. Do you have anything additional to add?
Well, I'll bring it home with. I agree with everything these guys have been saying, and my points about best practices are very similar. But I'd like to maybe bring it home with two pieces of advice that everyone will hopefully remember. The first one is think before you post, and everyone's been alluding to it, saying it. Think before you post. Remember what happened to Anthony Weiner. Once it's out there, even if you delete it, it's out there. So think first. That's number one. Number two is one of my favorite quotes. It was published, it was written by two guys from Boston, Brad Crotty and his colleague Mostagimi, I forget his first name. And I have the quote pulled up here on my computer. I'm going to read it. Social networks may be considered the new millennium's elevator, a public forum where you have little to no control over who hears what you say, even if the material is not intended for the public. They published that in Annals of Internal Medicine, 2011, and I use it in every talk that I give about social media. It is so important. It's no different from standing in the elevator, talking about your patients when other people are standing right there. And it's the same exact thing, except anybody can hear it. So just be careful when you do it. There's great opportunities, but also some risks.
And Eric, can I just add one more comment? I think it's also a responsibility of ours to participate in the discussion, because there are a lot of discussions out there which are quote unquote bad science, and I think as physicians we also need to participate and educate people, and I think that's also an important feature of social media for physicians, that we should be part of the discussion and correct errors or misconceptions that are out there.
Great stuff. And just a reminder to everyone, as you're getting ready to sign off, if you could give us your feedback on that survey, that would be terrific. We're going to actually take that survey away in about 2 minutes when we get ready for the online demo. it's one of the reasons that we invested in our promoting and MedTing guys, is we do believe that being able to promote private collaborations in a controlled environment with key functionalities that are important to physicians is a way to push the envelope in knowledge exchange and hopefully improve patient outcomes, especially on cases that sometimes are unique, and in rural areas you may not see as much, other countries you may not see as much, or even on a tough case where you have two groups of doctors at two different teaching facilities bantering about an ambiguity. It's always helpful. So we're pleased to promote the connecting smart medical professionals like all of you in an environment like that. I want to thank all of our attendees for participating. I know those of you on the West Coast, you're probably in the car, or you're staying a little bit late for us, and those of you on the East Coast taking some of your your off time to dial in and log in. We really appreciate it. And a special thank you for our 4 panelists, guys. Thank you very much. I hope we could do this again sometime soon. It was a really interesting discussion, and we could go on to maybe Social Media 102 the next time we all get together. So thank you very much.
Thanks for having me. Thanks for having us. It was great. Great discussion.
Thanks.
Yeah.
Bye.
Thanks a lot.
It's great to be here. Great to participate.
Thanks a lot, guys.